this is phase 1, stage 4, patient education and handouts. As a reminder, there are challenges associated with the first phase. So if you have not done the challenges associated with each stage, make sure that before moving on to phase 2, you go back and you complete those challenges. Participate in your community group. If you're not familiar with how to get to your community group, head back to the introduction and the orientation where it will allow you to see exactly how to get plugged in. Please get plugged in. That's the only way that you're going to really maximize this experience. As always, ask questions associated with each stage in the corresponding circles. So, patient education. I love patient education. I'm very comfortable billing for patient education. I'm confident that it is within our scope of practice. Two of our interventions, education and training, they are different. They are both necessary. Education is crucial. So can you bill for it? There are different schools of thought here. One school of thought, absolutely. There are many therapists, many occupational therapy practitioners billing for patient education, getting paid for it, getting reimbursed for it, not having any issues with denials. So keep that in mind that there is a huge body of professionals billing for this and getting paid for it within the United States. So if you are being told otherwise, remember that that does not mean that it's universal. So absolutely, you can bill for it. However, your specific sites, your specific administration, management may have unique viewpoints on that. And with that, I would encourage you to have a conversation. It's important to communicate. It's important to be an active participant in these decisions as a autonomous professional. Remember that you have a medical license, and your professional license and your name is going on your documentation. You are in charge of someone's health and well-being and their recovery. Okay, so do keep that in mind. Make sure you know why you're being told to do something or not to do something. Then you have absolutely not, which we just discussed. There are some buildings, I have heard it, I have worked in these buildings where they say you cannot bill for patient education. There are also there's a lot of controversy within our own profession where some people believe that it is unethical to bill for patient education, that you can't do such a thing. I've been told that. I don't agree with that, and that doesn't align with what I know to be true, but do keep in mind that there are some people who believe that is not okay. And then finally, sometimes I guess, right, there are a lot of wishy-washy people. Sometimes it's okay, sometimes it's not. It's okay if you do it a couple of times, but you can't continuously bill for it. So, I mean, there's no in stone answer for this conversation, but since you're here and I am talking about this, I am speaking on my lens, my vantage point. My vantage point is absolutely, it's within our scope of practice. It's one of the interventions available to us as stated in our OTPF, and therefore I am going to confidently use it and defend the heck out of it. Why do I believe that it is imperative for me to educate, and why do I believe that this is part of my scope of practice and requires my expertise? A couple of reasons. This is we're not going to head into this. There's a separate video on these models, but the reason why I feel so strongly about it is because of the C-M-O-P-E. This is a model that I abide by. It's one of the driving foundational components of my practice. So I believe that I need to be able to educate my client, first of all, on this model and to show them how their behavior, right? Why are they presenting the way they're presenting? what might we do in therapy that will help bring the most holistic healing? And that is what's discussed here. And then the model of human occupation, or MOHO. You hear a lot of occupational therapy practitioners reference MOHO model, and this is what that looks like. So habituation, volition, and performance capacity. It drives into occupational identity, occupational adaptation, and occupational competence. So we address participation, performance, and skills. Number one, the patient needs to be educated on the model and on the lens through which we are approaching therapy. You would be surprised how many people actually appreciate when I talk about this stuff, right? We address the patient the way they need to be addressed. We use language that they will understand, right? When I communicate with my professional comrades or my professional community, I'm going to speak differently than when I am speaking and explaining these things to my patient. And between patients differ, right? But still, it's important for me to educate, because if I can't equip my patient with knowledge about their occupational identity and their background and their prior level of function and their environment and all of these things, their roles, without being able to educate, how can I empower? How can I improve? I can't. Okay, so I use the C-M-O-P-E and the MOHO as my rationale for patient education a lot of the time. So, patient education. Occupational therapy's health management domain covers various areas for promoting well-being. Patient education falls into health management. We are going to be able to empower our patient. We work in both the biomedical model and the social model. We combine the two. Most of us work within that biopsychosocial framework according to the WHO's ICF, and it is the most holistic approach and holistic model to follow in terms of healthcare as it stands right now. Patient education empowers individuals to make informed decisions about their health. We're all about advocacy, not only advocating for our patients, but teaching them how to self-advocate. That requires education. So that is part of the education intervention, is equipping our patients with the information necessary to advocate for themselves and support their status of health literacy. Educating patients fosters internal locus of control, leading to autonomy and adherence to treatment plans. In my experience, the locus of control of an individual drives their ability to realize the fruition of their goals or achieve what they set out to do, regardless of what that looks like, whether it's to maintain, whether it's to improve, to learn how to augment their environment to better support their lifestyle, whatever that might look like. My job as a therapist is to ensure that they feel in control, that regardless of what their diagnosis is, regardless of what is causing the barrier, that they feel empowered, that they don't feel like their diagnosis or the environment or everything else around them is controlling their existence, but that they have the power to make a difference. They have the power to control a lot of these factors. And so that is the internal locus of control. There's a separate video on that as well. How can you do this? How can you build this arsenal that we're going to talk about in a moment? Downloading resources from the BOP portal provides evidence-based tools for quality care, and equipping yourself with resources you can help promote patients' health management and well-being, which we already discussed, but let's jump forward here. So this toolkit. I started making this toolkit day one of my private practice. So this was back in 2018. And as I started building these resources for adults in facing various diagnoses and challenges, I was thinking to myself, let's just make this available for everybody. So that's where the bot portal came from. But you don't need the bot portal, right? This is equipping you with your capacity to build a toolkit, your capacity to find resources online or in your continuing education, in your journey, in your experiences. Remembering that evidence-based practice is your expertise and experience, what your patient brings to the table, and then, of course, research. So you matter, and you can do this. You do not need me. You do not need the bot portal. However, we are so happy that you are here. So how do you build your toolkit? It starts with education on your treatment rationale and methods of intervention. Make resources that align with your treatment methodologies. Whatever you're choosing, whatever path you frequent to address certain conditions, if you find a protocol that is working for you, if you are constantly educating your clients on specific strategies like internal or external memory strategies, or if you're constantly telling them about community resources that are going to help the carryover of clinical work to everyday life, make your own education handouts, PDFs, and save them and start building that toolkit. Another thing you might consider is explanation of your clinical approach catered to individuals with low health literacy. So if you're designing your treatment interventions for an individual based on research, equip your client with that information as well. You're not going to take the article out and start reading exactly what you see on that article, right? Because a lot of the journals from which we read, they are off the hook, right? Off the hook with health literacy. They use words that I'm Googling and I'm looking up so that I can increase my health literacy. We need to adapt our tools for our clients. So do keep that in mind, that it's important. Many people are visual learners, and it's important for someone to see and understand what it is that's happening to them, around them, for them, and what you're bringing to the table as an occupational therapy practitioner. Don't assume that they understand what it is that you're doing and why you're doing it. It's always better to equip somebody with more knowledge than not enough knowledge of their care. One of the things I love about BOT clinical, so our clinics, is that we take the time to educate. And that's actually one of the reasons why doctors refer to us, is that we educate somebody on their primary diagnosis and what that's going to look like in their everyday life across a continuum or with secondary conditions. Okay, so keep that in mind. Another form of education is advice to enable advocacy for self and appropriate care. This not only means how to advocate for themselves in terms of the impairments that they're facing or the environmental support that they're seeking, but also what they can be saying at doctors, right? If you know that your patient has a doctor's appointment coming up, how can you support them? What can you do to help them communicate their needs better? If you have 5 treatments with a patient before they go to the doctor's appointment, and you're noticing certain things and you're talking to this patient about different things that are coming up, and you know that they should be telling their doctor, well, start curating a list for them. Start curating a list for them to bring to their doctor so that they can just kind of go down a list and not have to recreate the wheel or remember from scratch. They'll appreciate it, and their doctor will appreciate that guidance. So do keep that in mind. Advocacy and self-advocacy is very important. Home or interim exercises, activity programs to support continuum during off-therapy hours. Whatever you're doing as an occupational therapy practitioner in the clinic, you should be providing a resource to help them translate those skills into everyday life. That's not intuitive. That doesn't just happen on its own. It needs to be explicitly taught. You need to intentionally communicate how your treatment is going to translate into everyday life and give them an opportunity between sessions to realize how their skills, their gained skills from therapy, are translating if you don't have an opportunity to be in their context. Then finally, written materials to support clinical interactions. So just some ideas of ways that you can begin building this education toolkit from day one for your clients. As a reminder, what does Bot Portal have to offer to you? Here are some of the PDFs. These are just screenshots from the Google Drive. So if you have not already joined the Drive to access all of these resources, you prefer doing the links within the resource portal itself, that's fine. But just know that you do have access to these PDFs for easy printing options. So head over there. You can look in the comment section of this module and head over to the Google Drive and get permission and access. As long as you are a member of Connect or Thrive, you have access to the portal. Okay, so that is the end of phase 1. I do hope that you take the time to stop here, head into your community, complete your challenges, upload your picture, your introduction, and prepare for our collaboration phase, which is going to be, it's going to be very important. Engagement is going to be very important. So I look forward to seeing you in phase 2.